Welcome to In Focus. I'm your host, Yesenia Taveras. The month of November is Diabetes Awareness Month, and organizations across the country are making sure that they're bringing awareness to this disease. The YMCA of Delaware in particular has a diabetes prevention program that thousands have taken advantage of. And joining us now is Tricia Jefferson, who is the Director of Programs and Partnerships, and Edna Waller. Welcome to the show.
Thank you. Thanks for having us.
Yes.
Thank you so much.
Thank you for coming. I believe this is such an important topic, diabetes. It affects millions here in the country, and it can be prevented. And so let's get right into the YMCA of Delaware's role when it comes to those who are pre-diabetic or diabetic.
Yeah, so we've actually been running a diabetes prevention program that is recognized by the Centers of Disease Control since about 2010 here in Delaware. So essentially it's a program that is open to those that are members of the Y as well as those that aren't. So it is run throughout the state in all areas of the community, not just at Ys, but in local organizations like senior centers or community centers, libraries, schools, really ensuring that we're trying to reduce the risk of developing type 2 diabetes.
And what are some of the signs of those who do have diabetes?
Yeah, so that's a good question. So the signs of diabetes are, if someone is experiencing, maybe some increased sweating, they may feel a little bit lightheaded, they may find that they have more frequent going to the bathroom more frequently. But unfortunately for those that have pre-diabetes or if they're at risk of developing type 2 diabetes, there are no outward signs. Okay. Most of the time, someone who has pre-diabetes is identified by their healthcare provider through a lab value or their glucose or blood sugar level, or we're able to do a risk test that really focuses in on their family history as an indicator. If they're over the age of 45, if they've had gestational diabetes, or even a baby over 9 pounds. Some of those are factors that would increase their risk, as well as not being active and having just an elevated BMI. So they might just carry a little extra weight. Are some of the risks. And so really it's just making sure that people think about their current lifestyle as well as their family history and make sure they're talking to their doctor.
And like you said, Tricia, this is a lifestyle, and it's really about knowing your numbers. A lot of employers are really taking the initiative to make sure that their employees are getting screened, they know their numbers, they know what they're working with, because let's face it, a lot of us tend to not go to the doctors until something is completely wrong. But we have to understand with diabetes, there's steps that actually get you to the worst case scenario, and we're trying to make sure that the YMCA of Delaware prevents you from getting to that level. Yeah,
and a lot of employers are bringing the program on. The state of Delaware actually brought it on as a covered benefit for all state employees. Under the Highmark umbrella, if someone has Highmark, they're eligible to enroll in the program at no cost, as well as if they have Aetna, if they're a state of Delaware employee. And they did that because they were really interested in cost savings, in regards to how much can they save. Healthcare costs are extremely expensive, and I believe the projection is close to about $1,400 in cost savings for an employee. And in those in Medicare age, the cost savings was about $2,600 per participant if they can avoid type 2 diabetes.
And that's wonderful to make sure that it is covered by your insurance. And the YMCA of Delaware is one of the first organizations in the country to make sure that their diabetes prevention program is an eligible covered benefit.
Yeah, and so Edna played a huge part in that. A few years ago, our National YMCA received some funding to pilot the diabetes prevention program in the Medicare population for those 65 years of age or older.
So let's talk about that, your experience.
Oh, it was such a wonderful experience, and I found out by an accident. I was talking with my friend who at the time lived in Virginia. She's passed on. But she said that, why don't you talk to somebody? So I called. And I couldn't get a place that I could go in the daytime because I wasn't driving at night at that time.
Okay.
So what they did is they allowed me to find a place, and I did. The Newcastle Senior Center is where we do it. And when we went there, I got this wonderful coach. Her name was Joanne. And they supply you with the tools that you really, really need. It makes you understand how to read labels on food. It makes you understand how important it is to move your body. 350 minutes a week. If you're only doing nothing but sitting at the TV lifting Campbell soup cans. But it's something that you're doing, you're moving. And your walking is really, really good. And on the program, when I went there, I was 50 pounds heavier. I have removed those 50 pounds because I've watched the label from the education that I received from the diabetic prevention program.
So you did a little bit of making sure you ate healthier and
Yes.
also weight training?
Yes, yeah, and I do hula hooping as well. I have a 2-pound hula hoop that I do daily in my living room because it's in a big enough space for me to do it. And I will also walk 4 miles a day with my husband in the mall, in the Christiana Mall. As long as you're moving and as long as you're getting the right food, not so much processed food, and I'm a firm believer, if you read the label, you'll get an education, because most times you just pick up food, but when you start to look at the label and see what's in it, what's in it's going to harm you.
That's right.
And growing up, I grew up in the South, where my mom and my grandmom cooked with a lot of love, with a lot of calories, a lot of things that really wasn't good for you. But we played in the yard. We were active, and that's why we probably never thought about it, because my mother and my grandmother always was doing things, and it wasn't like that we weren't working. But it's also up to you, and it's an individual thing, I think. You have to accept the fact that you want to take control of your
That's right,
health.
the initiative.
And also, like you say, you should go to the doctor. I don't care how old you are, just make sure you at least go to the doctor and get a physical once a year. That's how I found out that I was on my way to being a full-blown diabetic.
Oh, it was your preventive care checkup?
Yes.
Okay.
And that's really important. I can't say that enough. And when they do the blood test and they tell you what your AC1 is, and they tell you, that's an important number. And that was a number that I didn't understand. But being on the program, they have all of these tools for you, and they gave you a tracker, which is important. If you bite it, you write it. So that's a term that I got.
Accountable.
Yeah, you got to be accountable, and I just really feel really good. I have a lot of energy, much more now that I've removed the weight, because, like I say, I removed it. I'm not gaining it back in my mind. I'm where I want to be. And what I would just like to say, if I could reach somebody, just one person, that's a wonderful thing. Each one tell one. And if you don't tell them about the program, a lot of times people don't have the initiative to know what's going on. So I'm singing like a bird, telling everybody to join.
As you should be.
Yeah, and I'm happy to say that the Newcastle Senior Center will continue to allow it to the wider use the space. So it works out.
Okay.
And I like to go to drop in on some of the meetings sometimes just to see how people are doing, to give them some kind of inspiration. So yeah.
Oh, that's wonderful. And like you mentioned, Anna, the education is so important. The reading the labels, things of that nature. My daughter was at 3 diagnosed with hypoglycemia. And so that's like the opposite of diabetes, right? And so your glucose levels, you still have to monitor them, but she was in the PQ for a week, and it was just so happened to be, she got off the bus and she was very fatigued, lethargic, really couldn't talk, and we never knew that she had this, and it wasn't until the nurse had pricked her, checked her glucose level, and it was down to a 23.
Oh, wow.
So put
That's
her in the
really
hospital
low.
for a week, and the glucagon didn't work, so we knew she didn't need the insulin. And so a lot of those type of experiences can make one very overwhelmed.
But today, the wonderful thing is they have so many ways that can
Yes.
prevent you from doing it. So that's up to you.
That's
If
right,
you
I
have
mean,
an insurance
education.
plan, the insurance is going to pay for you to go to have this visit. So I encourage everyone, men, women, young people, to think about their health, think about their future.
Yeah, and that's one of the announcements we wanted to kind of really touch base on today, was that now Medicare
Yes.
is covering the diabetes prevention program. So not only do we need to go to our healthcare provider and ensure that we get the screening, even go online and take the risk test to see if you're at risk, but now Medicare beneficiaries can enroll in the program with no out-of-pocket cost. So essentially they'll enroll in the program, there's no cost sharing, and we'll bill Medicare on their behalf to take part in the program.
And that's a huge weight lifted off someone's
Yes,
shoulder.
it is. It
Tell
is.
us
It
about
really
that,
is.
that addition to your benefits.
It's wonderful that they did everything so I did not have to go to Medicare myself, because being in the Medicare program, sometimes you have to go and ask for certain things that you don't know. The doctor will say, well, you got to take this test, you got to take this test, but I'm the one who want to know who's going to pay for it, or how am I going to pay for it. I know I have to have it and I don't mind it, but just let me know up front what I have to do. So they took the weight of doing this for me, and I cannot say how much it has done for me and my family, because it has educated me on a lot of things, and I'm taking the things that I used to my son and my future daughter-in-law, and I said, this is the way you should take care of your body. I always believe that your body is your temple, and only you can sculpture it.
That's right. You have to be mindful of what you're putting into it.
Yes, that's right.
Always.
Yeah.
And let's talk about what this looks like, the diabetes prevention program. As you mentioned, there is a coach, but if we could walk in the day of a life of a participant or a coach, what does this program look like?
Well, when I first went in, we didn't know what to expect. They weigh you very privately, or everything is making you feel comfortable as possible.
Oh, that's great.
And then they give you a book, and then they go over the book, and they give you this wonderful book, Calorie King or something.
So there's a Calorie King book we give our participants.
They give the participant, and then we had the Spiral Notebook, and we had homework. And they tell you the first thing that I learned is to become a fat detector. When I say fat detector, knowing how much you weigh and knowing how much fat intake you should take during the course of the day. That made the difference for me. When I saw the difference for me for that, and did all the things that you have to do, and it was a book, it was a tracker book. We had to put down how many times what we ate, whether we walked, whether we were over, and it's no embarrassing thing like, okay, I didn't lose weight this week, I didn't do this. They don't make you feel like that. And sometimes when you go to a place where you're embarrassed, like when I first went there, I was really embarrassed in my weight. But now, I'm fine with it.
Right.
I took myself
And you
back.
made steps.
That's what you do. It's called taking yourself back, taking care of yourself, loving yourself enough to want to be healthy.
Yeah, and Edna, talks about the program and what she's experienced better than anyone. But all of our participants will experience, hopefully, some form of what Edna has experienced. And the Y didn't create this program. It's actually part of the CDC-recognized National Diabetes Prevention Programs. It's a structure that was highly researched, actually shown that the 5 to 7% weight loss can decrease the risk of developing type 2 diabetes by 58 to 71%. So that's super important, because a lot of people know so many individuals that have type 2 diabetes. They think that they, especially if it's a relative, that they'll probably get it anyway. Right. And the key is learning that it is preventable. And I think the other thing to think about is we always want results really quickly. Yes. So having things happen very fast. And if you've thought about any behavior change that you or someone else has ever tried to make, it usually doesn't happen overnight. It takes a while to make change. So the program is a year-long program. It runs once a week for 16 weekly sessions, and then we have a few sessions that run every other week, and then monthly to complete the year-long program. And as Edna mentions, it can be run anywhere throughout the state. It does not have to be run at the Y, although we do run them at every branch. And it's a group-based setting, so participants feel the accountability from each other, which is really nice, that peer-to-peer support. And then there's a coach there to provide them the tools that they need. And they work together throughout the year to really focus in on healthy eating, physical activity, and really the most important component is behavior change. How do we make those changes? Because we all know we're supposed to eat healthy and exercise, but the question is, how do we actually implement that in our life?
And that's the biggest hurdle.
Yeah.
And also, when you're in classes like that, the one thing that Joanne told us, we're all not going to be on the same page. We're all not going to be able to lose the same amount. It depends on what we do. And when I was at the class, I used to always bring things that I did, because I think visual things are really good. And I used to have this thing, I make salad in a jar.
Okay.
And when you put the salad in a jar for a week, you know you're going to eat that salad. Part of that is going to be your meal plan. And when you plan your meal, you know exactly what's good and what's not. And like every lick and tick you go in your mouth, you have to really be mindful of it. But then after a while, you get used to it. Now, I haven't had a soda, and it's got to be about 3 years, and I don't even miss it.
That's right.
I do not miss
That
it.
happened to me. I won't name the label that I drank, but
I won't either.
I haven't drank it in so long. I remember it was like maybe 10 years ago or so. I had said, oh, let me just take a sip of it, and then I ended up just breaking out. And so your body, I guess, over time gets used to not intaking
what you have
that
done.
kind of substance.
You've cleansed yourself of all the impurities that's not good for you, and it gets used to another thing. It's just like anything else. It's just like a car. If you don't take care of a car, the car is going to break down on you.
We do make sure we have our oil changes.
Yes, we do. Yes,
Got to
we
do the
do.
same thing with your temple.
Yeah, exactly.
And sometimes I think it's really tough to do what Ed is talking about, is really focus in on yourself. We have a lot of individuals that, if you're a working parent, you're really focused in on taking care of the young people that might be in your household.
That's right.
If you're an older adult, you may be taking care of your parents and now being a caregiver for those that took care of you. So we find that's a challenge for people, actually, is to really focus in on themselves and really allow themselves that time. And that's why, they do meet weekly and have that accountability and are there to support each other in a peer-to-peer relationship, because it sounds easy to make those lifestyle changes, but it's not always easy.
No.
We know.
And it takes time, like you
And
said.
another thing, to use a good analogy, is like if you go on an airplane, the airline stewardess, if you have a baby with you, the airline stewardess will tell you to take care of yourself first so you can take care of the
Right.
infant. So you have to use something, you need an anchor, something to make you realize how important you are.
That's right. Because like we said, if you don't do that now, over time, it can get worse.
Right.
So that's why it's very important to take that initiative now. And the great thing too that I love about the YMCA is that you do have the availability for childcare. So while you are going through the program or having to go visit the weight room, your child is very well taken care of. And so the organization is really helping to eliminate the excuses or the reasons why it won't work. But here they're providing the coaches and the platforms, and they're mobile. Like you said, they're coming to you to make sure that this is taken care of.
Yeah.
And it's so personable because the classes are not too big that you're not listened to.
Oh, that's great.
And I think I had 8 in my class, and I think now they may have a little more.
Yeah.
But 8 to 10 people is a wonderful start, and especially the people who are going for the first time.
That's
Yeah.
needed for that individual attention.
So all of the groups, as Edna said, are typically anywhere between 8 and 15 participants. We can go up to 18, but most of our classes we find are anywhere between that 10 to 15, which is really nice, because typically you find others that you connect with. We do find a lot of individuals that buddy up. Edna can share, she still actually meets with some of the participants in her group. So
Yes.
I think that's one of the things we found. Edna took part in the program in 2015, actually, when we were piloting the Medicare coverage for those over the age of 65. And what we found was individuals over the 65 really bonded with others. Many times they would join together. We had a lot of couples that joined together, as well as friends that recruited other friends and told others. So it's just a really interesting dynamic, and they're very motivated and interested in being engaged and really now taking that time to focus on themselves after all those years of working and caring for others.
And that's a great opportunity to develop such a partnership, because as Enda mentioned, that could be of some type of shameful, or man, this is how I am now after all these years and I didn't really take care of myself. But here it's like, no, it's okay, and here you have another person who's just as invested as you are.
And a lot of times we as women have to remind the men it's okay to come with us. We had one man in our class, I won't call his name, I recruited him to come join Zumba with us. He did the Zumba classes with us. And we still talk on the phone, so it's just a wonderful thing. And he said, I never knew that I could be back down to a size 32 waist. And every time that he would come in, he was like, okay, what kind of exercise do you have? Because I used to bring visual things.
Okay.
I said, well, let's do this and let's do that. And we would, and sometimes we'd just say, just simple walking up and down the stairs.
Wonderful.
Yeah.
And that's a great thing about YMCA, and that's why I left my prior gym and came to the Y, because it's so community based. You really don't get that anywhere else, where everyone's coming together as one.
Sometimes when you go there, it's really hard to leave without seeing people you know, because
Right.
they talk to you, they know your face, and my face is pretty well known there. So I try to pick my time when I go, but I do take time to talk to people, because I think it's important for me to tell them why
Yes.
I am doing this and why they should think about doing it.
Right.
Yeah, there's lots of options. We find that a lot of our participants really enjoy the water aerobics classes, as well as the Zumba. We do have yoga, chair yoga, lots of, one of the components of the Y is once you're a member, it's almost, you have access to mostly everything in the building. So all of the group classes, the water, the family swim, as well as the fitness center. And some of the key components are some of the additional programs that we offer at the Y that maybe people don't think of, that are a little bit outside of the box. We do have a few other programs in regards to our healthy living programs. In addition to diabetes prevention, we have a Live Strong program at the Live Strong at the YMCA, which is for cancer survivors, and a weight management program for adolescents and their caregivers. So really trying to focus in on how do we improve the health of individuals in our community. We go to the doctor and they give us this advice to eat healthier and exercise more. And there's a cost barrier with some things as well. And so at the Y, we really try to offer financial assistance when we can, not just for programs, but for membership, in addition to really working with the health insurances and that we have in Delaware to try to cover the programs that we have and allow individuals to take part. It reduces some of those barriers.
Right, because I do know the Y has the scholarship opportunity as well if you do have income or financial hardships.
Yeah, so it's a really important thing, for anyone who is looking for an option to not just get healthier, but a place for their family to connect and really, be part of a community. We offer financial assistance for our membership at every one of our branches throughout the state, as well as nationwide at other Ys throughout the country. And a lot of people don't know to ask for it. So it's called our Open Doors program, and it does allow individuals in our community to, we don't want to turn anyone away. We really want to open our doors and ensure that we're a diverse organization and that everyone can really find a sense of community. Whether it's a mom who has a newborn infant, someone who's a new empty nester, someone who might be going through their quarter life crisis, or even our older adults who are looking to reconnect, once they maybe retire, or looking for new connections and a sense of community.
Wonderful. Any departing words before we go? And I was going to say the great thing about the Y too is everything's interchangeable. If you can't make it to the one that's close to your home, you can go to another one that's close to your job. It all works together.
And the number of hours is open to you.
Yes.
And that's another thing. 5 o'clock in the morning is maybe good for somebody before work. And I've done that. And actually, it's a full crowd there sometimes. And it's really awesome just to see how many people can get up and be that motivated to do it. So if we could get everybody in the country to become aware of themselves and do things that's going to be beneficial, the Y is the place I would really say to go. And I'm not really saying it because I was a part of the program, but every other gym that I've gone to, like you say, it's not the same as the Y. I like the community. I like the feeling I get. I like the way I'm treated. I like the facilities. I like what they have to offer.
That's right.
So thank you for having me.
Well, thank you so much, Tricia, and this was wonderful. Thank you for sharing your experiences and really educating us at the same time.
Yeah.
Thank you. Thanks for having us.
Thanks for having me.
Yes,
It
you're
was
welcome.
wonderful. Thank you.
And on behalf of all of us here at WITN 22, I'm Yesenia Taveras. Thank you so much for watching.